Hello, everybody. So, for those of you that don't know, today was kind of a big day in Colorado. We got the latest number of uninsured Coloradans, and it shows a huge decrease in the uninsured population. Colorado has cut our uninsured population by about half, which is phenomenal for 2 years of big work under the Affordable Care Act, or Obamacare. So, we are here to talk about this today and what some of the data means and what some of the issues might be going forward. So, first thing, just looking at the raw numbers, Colorado's uninsured rate in 2013 was 14.3%. It is now down to 6.7%. It's a huge decrease, and that decrease really happened across all populations, and is really just a huge achievement. Now, looking at the numbers a little more closely, there are a few things that jump out. One, there's fewer Coloradans that are facing medical bankruptcy. That number changed from about 104,000 to just about 45,000 in 2 years. And that's a huge indicator of how people are doing as far as accessing medical care. Medical bankruptcy used to be the primary driver of individual bankruptcies in the country. So that's no small achievement. But on kind of the other side of this data, we're also seeing some consistent or persistent health insurance disparities. Most notably, the Latino community continues to have a much higher rate of uninsurance than the rest of the population in Colorado. Even though the uninsurance in the Latino community was cut by about half, it's still much higher than the rest of the population. It's about double the rate of the rest of the population. And that's concerning. I think we are hoping to see not only a big cut in the uninsured number, but that disparity was a little bit decreased. A few other things of note, you have a lot of lower and moderate income Coloradans getting the most benefit out of Obamacare. They're the ones that have gained health coverage the most in Colorado in the past 2 years. And that's not really surprising considering Colorado expanded Medicaid, and all of a sudden, with the Affordable Care Act, Coloradans also had access to financial assistance to help them afford their premiums. And that particularly low-income Coloradans benefited the most from those tax credits and Medicaid expansion. Now, there's been a lot of concern today in some of the media about Medicaid expansion and kind of what it means for state budget. And that's a valid concern, but looking at these numbers, they've been a little misconstrued. So if we're looking at the share that Medicaid has taken as far as how much of the population is covered by Medicaid, it's increased significantly, but that doesn't necessarily mean that it's crowding out other sources of health insurance. You have overall, you have a lot more Coloradans insured, and so that shifts kind of how the percentages are being represented. And also, that number of Medicaid-covered lives in Colorado reflects a lot of folks who were previously eligible for Medicaid prior to Obamacare, but were not enrolled. So those are people who were technically eligible before health enrollment, but hadn't gotten covered. And so because of all of the attention around health insurance and open enrollment, they were able to get covered, which is a good thing. It means that fewer people face medical debt. It means that fewer people are delaying seeking medical care. And it really does benefit the healthcare system overall, because you don't have hospitals and providers fearing not getting paid for the services they're providing. We've already seen a huge drop in uncompensated care in Colorado, and so we know that that is making it easier for healthcare providers to know what they're going to be paid, and whether they're going to have a source of payment when they provide services. And that's important, because if they're looking at unpredictability as far as their own revenue, it means that they have a hard time pricing their services, and often that was resulting in what's called cost shifting. And so you had the services provided to uninsured people really contributing to the premium increases for those that had private insurance and employer-based insurance, which isn't really fair, and it's not really how the system is supposed to work. So overall, we've seen a huge uptick in the people with insurance in Colorado. The other thing of note is that there are regions of Colorado that are struggling more with high premiums and cost, particularly the northwest and southwest corners of the state still have a much higher rate of uninsurance. And that really kind of corresponds with where premiums are highest in Colorado. And so that's a persistent problem that I think Colorado is going to have to grapple with. But we haven't necessarily been able to identify exactly why costs are so much higher out in those areas, other than identifying that there just aren't enough providers. And that presents a lot of challenges. So, just a couple other notes. Another thing that has come up since this report came out is that we haven't yet seen a decrease in emergency room utilization. And that's true, and that's not necessarily unexpected. Massachusetts, when it expanded healthcare for almost everybody in the state, they experienced a similar thing where actually emergency room visits went up slightly, and then sort of tapered back off, but stayed relatively high. And what we're seeing in the CHAS report is really that the people who are in the CHAS report, we're seeing that most of the people who are accessing the emergency room are doing so largely because they need care outside of normal doctor's office hours, and they don't feel like they have another option to seek care, which is potentially true, but in some cases they may be going to the ER when they may not have a quote-unquote emergency, which is not beneficial for the health system and jacks up costs for everybody. But it really speaks to the issue of how can we incentivize providers to look at how they're structuring their work days, and can we incentivize them to provide appointments outside of normal office hours, either in evenings or on the weekends, so that people aren't inappropriately utilizing the emergency room. So overall, huge win for Colorado, huge win for Obamacare. There are so many more Coloradans that have coverage and can say thanks because of Obamacare. And there are some things that we need to work on, obviously, out of this report, but overall, it's a huge win for Colorado's bipartisan efforts to expand Medicaid, build our own health insurance marketplace, and do health reform in a way that makes sense for Colorado. So that's the end of this Periscope, and if you have questions or anything, feel free to email us, and we will be in